start? Okay. Good afternoon all of you. I am Dr.Deepak from Rural Inter College Loni. Basically I am from Department of Prosthodontics. Our department, that is Department of Prosthodontics, mainly deals with the replacement of the missing teeth or any tissues related to the teeth or the maxillofacial prosthesis. That means any part of face is missing. It basically deals and is patients are treated in our department, that is Department of Prosthodontics, Crown and Bridge. This deals with the replacement of the missing teeth. Okay. Today's topic for our lecture is given to us is that what are the different causes of the partial and complete loss of teeth and associated structures. So I will start with my presentation for the same. So there are different causes for the missing teeth structure, that is in few patients all the teeth will be missing, or in few patients only the one or two or many more teeth will be missing. So when there are tooth loss of single tooth or multiple teeth are missing, that means the patient is called as partially edentulous. Okay, and if complete teeth are missing in individual patient, that patient is called as completely edentulous patient. So there are different causes for the missing teeth in an individual. The missing teeth can be classified under partial or complete missing teeth in an individual. So edentulous, first we will see definition, what is the prevalence rate, what are the problems and their management. So outline of today's lecture will be introduction, then definition and types, causes and prevalence, problems, management in brief, because there are different lectures will be carried for you related to the management, then conclusion and references. This is the first lecture from Department of Prosthodontics for 3rd MBBS students, which basically deals with the missing teeth structure. The subsequent lectures will be related to the discuss the local and systemic sequelae of the above, then identify complete what are the different types of teeth present intraorally and identify the missing teeth. The next lecture will be related to the enumerate common ways of restoring the edentulous state. Then how to consult patient on the importance of restoring missing teeth tissues with respect to the benefit on oral and systemic health. Enumerate the parts of teeth. All these lectures will be taken under our department. Now today's lecture is related to what are the different causes for the partial or completely edentulous teeth. So outline, as I told, is introduction, definition and types, causes and prevalence, problems, management, conclusion and references. So in introduction it will be said that edentulism is the condition of being toothless to at least some degree in humans that naturally have dentition. Okay, it is the result of tooth loss due to injury or disease. So accordingly we will have classification. Sometimes in patient the tooth loss is due to injury or any sort of the disease. It is a debilitating and irreversible condition and is described as the final marker of disease burden of oral health. Coming to types of the edentulism. So there are two types of patients in this category. One is partially edentulous patients, second is complete edentulism. As the word says partially edentulism, that means few teeth are missing. Suppose a patient has 28 teeth. So in that 3 to 4 teeth will be missing. But in complete edentulism, total 28 teeth will be missing from upper arch and lower arch. For those patients, we will have different treatment plan, and for the partially edentulous patient, we will have a different treatment plan. So to revise, there are two types of edentulence, namely partially edentulism and complete edentulism. In our department, both the patients are treated very well. So this is an image showing the example of partially edentulous patients. In this, we can see that patient is having missing anterior teeth. Anterior teeth involves central incisors and lateral incisors, where we use those teeth for incising or eating the food. Basically these anterior teeth are used for the aesthetics purpose. When these teeth are missing, there will be great loss to the patient in aesthetic zone. So partially edentulism, as shown above, is a loss of some teeth in the mouth. Basically deals with the anterior or posterior teeth will be missing. So partially edentulous is the patient having single teeth missing or multiple teeth missing, but few teeth will be remaining intraorally. The causes may be different for this condition. This is an example of the patient where we can see that complete teeth loss is seen. both maxillary arch and mandibular arch is having missing teeth. We can see that there is no root piece seen, no pathology seen, all the teeth are missing. So in this type of patients we can give complete denture. Okay, so as shown in the picture above, complete edentulism is loss of the teeth in the mouth, that is maxillary and mandibular arch both. What are the causes? This is the main slide. The causes may be categorized under biological factors and non-biological factors. Okay, these are the two major factors irrespective of the other factors. We can categorize our causes into two headings: biological factors and non-biological factors. What are the points which can be considered under biological factors? The first will be age, second gender, third diseases like dental caries, periodontitis, tooth infection and hypoplasia. In non-biological factors, the causes may be trauma, dental care and poor oral hygiene. Now we will see the biological factors. Basically, why age is given under biological factor? Because as the age of the person or the human being increases, that is from the youth to the old age or elderly age, there will be different periodontal problem. There will be bone loss. As the age increases, there will be deterioration of the oral health, irrespective of the condition of the oral hygiene. Okay, so as age increases, there will be bone loss, there will be gingival inflammation, there will be gingival recession, the gingiva will have problem, then there will be bone loss. As there is bone loss in the other body parts, same way intraoral there will be bone loss around the teeth. So there will be, if there is bone loss around the teeth, what will happen? The teeth will get mobile. There will be no support for the teeth. So what will happen when there is no support for the teeth, and if patient will not consult any dentist, then there will be no chances of saving that teeth. So slowly what will happen? The teeth will start having mobility. The mobility is divided under three categories: grade 1, grade 2, grade 3. If there is grade 1 mobility, there are chances to save that teeth. If patient is having grade 2 mobility, there are 50-50 chances to save that teeth. But if patient is having grade 3 mobility, that means the teeth is more mobile, that is apically, mesodistal, then we have to go for the extraction of teeth, or naturally the teeth will get exfoliated from intraoral. Okay, so age is the one of the factor. Gender, in gender, sex, that means male and female. Females are having different problems related to the hormonal changes. So according to the hormonal changes, there will be bone loss, severe bone loss, and there will be mobility of the teeth, and lastly the teeth will get exfoliated. Okay, the third is diseases like dental caries and periodontitis. If patient is having any systemic diseases like diabetes mellitus, in diabetes what happens? There is problem with the soft tissues. If there is periodontal problem to that patient, the healing will be delayed in diabetes patient. So in short, there will be gingival problem, and again there will be mobility, and teeth will get exfoliated intraoral. Okay, so these are the various reasons related to biological factors. Tooth infection. If there is infection of the natural teeth, we cannot have. There will be painful. There will be experience. The experience of the patient will be painful. We have to go for the removal of that teeth, because that is giving pain to the patient, and other teeth are having problem due to that XYZ teeth. Okay, the next factor is hypoplasia. There are different clinical conditions in dentistry where the teeth will have different problems that is related to enamel, dentin and pulp. So this problem is categorized under that. During the developmental phases, there will be problem related to the teeth, and due to that the teeth will be compromised, and we have to extract that individual teeth due to the inflammation or the underlying pathological condition. So these are the biological factors. In biological factors, different syndromes can be also included. Example is Papillon-Lefevre syndrome. In the Papillon-Lefevre syndrome, there is neonatal problem of having missing teeth. That is the maxillary mandibular arch of the patient is partially edentulous. So in certain syndromes also there are different tooth problems. So those problems are considered under biological factors. So this was the one of the cause for the tooth loss, that is edentulism. The second problem is related to the non-biological factors. That means these factors are due to external causes. External causes, that means that may be trauma. If patient had accident, bike accident or any road accident, that time there will be trauma to the teeth and the adjoining structures. So these problems, this cause can be included under trauma. Okay. Second is dental care. If patient does not take care of the oral hygiene, that time also the periodontal problem, there will be periodontal problem, oral hygiene problem, and naturally there will be problem to the teeth. The third problem is poor oral hygiene. Okay, if patient does not maintain the oral hygiene, then also there will be problem. If patient has different habits of tobacco chewing, smoking, or any other problem, that will hamper the oral hygiene of the patient. That will also cause the problem to the patient. So these are the different causes by which there will be tooth loss in the patient. So these points should be considered properly so that there will be no problem to the patient. Okay, so there are mainly two causes, biological factors and non-biological factors. The prevalence rate, the different countries, due to the different location, different demographic, socio-economic status, different gender, age and lifestyle will have effect on the prevalence rate of the edentulosism. So according to different countries, according to different location, according to this different lifestyle, there will be the prevalence rate will be different for different location and different patient. Coming to what will be the problem if there will be edentulism. If patient is not going for the dental treatment, what will be the problem? Basically, the problems will be decrease in masticatory efficacy, difficulty in word articulation, the pronunciation of the different words will be hampered due to missing tooth structure. Suppose if I pronounce certain words starting from label words, label sounds, the anterior teeth will have a different effect on the pronunciation of the words. So difficulty in word articulation, social embarrassment and isolation. Suppose my anterior teeth are missing, patient is having anterior teeth missing. The aesthetic concern of the patient is increased and there will be social embarrassment to the patient. For that purpose, certain jobs will have to replace the missing teeth in the anterior region. Okay. Then modification of the nutrition. Suppose the posterior teeth are missing, so our patient will have problem in mastication of the hard food. Okay. Suppose my posterior teeth are missing, I will have problem in mastication of the hard food, and naturally this will lead to the nutritional problem and the indigestion to the patient. Pain, distress, relaxation problems. So in short, the problems associated with the edentulosism is for the aesthetics, mastication and phonation. You have to keep in mind three problems basically. All the other problems are categorized under these three headings: mastication, phonetics and aesthetics. Okay, these are the three problems basically patient has. What will happen if there is problem in the masticatory efficacy? If there is problem in masticatory efficacy, there will be indigestion to the patient. Okay, so what will happen? They allow physiologically, teeth provide for a greater chewing ability. They allow us to masticate foods thoroughly, increasing the surface area necessary to allow the enzymes present in the saliva as well as in the stomach and intestine to digest our food. In edentulous patients, masticatory efficacy is really reduced as they cannot carry out the process of chewing so as to aid digestion. For this reason, the patient has to go for dental treatment to replace the missing teeth. Difficulty in word articulation, that means for phonetics. The teeth plays a major role in speech. Some letters sound require the lips and or tongue to make contact with teeth for proper pronunciation of the sound, and lack of teeth will obviously affect the way in which an edentulous individual can pronounce these sounds. The consonant sounds of the English language, that is th, z and x, are achieved with tooth to tooth contact, basically the anterior teeth. Now coming to the next point, social embarrassment and isolation. Edentulous people may feel embarrassed about their appearance and not want to go out and engage in social interactions and activities due to the missing teeth. In addition, edentulous people often have to face stereotypical perceptions of being poor, uneducated and or unhygiene. So if there are teeth missing in the anterior region or poor oral hygiene, so basically what the social thinking is there in our area, at least, that this patient or this person may be poor because he is not maintaining his oral condition and not replacing his teeth. For this purpose, in today's century, at least we should go for replacement of the teeth for the particular patient, or we should make understand our patient the importance of anterior teeth for aesthetic purpose, so that there will be no social embarrassment and isolation of particular human being or the patient. Deformity in facial appearance. So as we have seen elderly patients, if there are total missing teeth, that is anterior and posterior, the lower facial height is reduced and the appearance of the patient is not symmetrical or not pleasing. So in total edentulous patient, there is overclosure of the lips, protrusion and spread of the tongue, leading to deformity in the person's appearance, thereby reducing his/her facial aesthetic appearance, limiting career opportunities in modeling and news casting, etc. There are certain career opportunities. That means, like if a lady has to go for the air hostesses, she has to replace his anterior teeth, because there are certain in their forms for the selection, there are certain points for the physical examination that patient has to give history regarding the past dental history of the particular individual. Okay, so patient has to go for the replacement of the anterior and posterior teeth, so that there will be proper facial appearance of the patient. Then we will come to the last point of this presentation. I will go in brief for this management. So different treatments are available to replace this partially and completely edentulous patients. Okay, so the branch which deals with the replacement of the natural dentition is managed by prosthodontist. Okay, prosthodontist, who concentrate on the replacement of the missing and the restoration of the natural teeth. Periodontist, who focus on the prevention, diagnosis and treatment of periodontal disease and the placement of dental implants. Endodontist may also be consulted for possible endodontic treatment to save hopeless teeth. So this is the teamwork for the replacement of the anterior teeth. As a prosthodontist, we should first see that any periodontal treatment is needed. Any endodontist has to be involved for the particular teeth. After they finished with their treatment, we can go for the replacement of the missing teeth by the prosthodontist. Okay, according to the case history findings of the particular patient, we will see that we have to replace single tooth or completely teeth we have to replace in individual teeth. That will be decided after thorough checking, that is proper in detail case history of the patient. There are different methods to replace missing teeth. That may be by the removable prosthesis, example is dentures. Then by the fixed prosthesis, that means by the dental bridges, which are called as fixed dental prosthesis. And the advanced dental treatment is by replacement of the dental implants. These are the three basic example of the management of the replacement of the missing teeth in partially and completely edentulous patient. First is removable prosthesis, second is fixed partial prosthesis, third is advanced dental treatment like dental implants. The examples of the removable prosthesis are dentures. That means the patient has to remove the teeth at night after using it for mastication, and morning again he or she has to wear the denture intraorally. These dentures are example of removable prosthesis. The second example is fixed partial denture. That means the teeth can be removed only by the dentist. Those are fixed. Those dental bridges are categorized under fixed prosthesis. That means patient cannot remove those bridges. Those are fixed. This is the common treatment option taken by the patient in our area. Now the recent advances, that is replacement of the teeth by fixed prosthesis, the examples are dental implants. In this, there is no need to take support from the adjacent teeth. We can directly focus on the edentulous area. Suppose my incisors are missing, anterior teeth. We can only focus on the anterior teeth and alloplastic material, that is the dental implants. Okay, those are inserted into the jawbone. We prepare the area, we take the incision, we prepare the area to receive the dental implant. Certain drills are used to have space for the dental implants. Then we place dental implant intraorally in the jawbone. After few months, there is the process called as osseointegration, which takes place between the living bone and the surface of the dental implant. After 4 months, the implants get properly adapted, properly osseointegrated intraorally into the jawbone. They are adapted properly, and after 4 months or after 6 months, that means the bone maturation period is around 6 months, we open that area and on that dental implant we place an abutment, which is the suprastructure which is placed on the dental implants, and we make the impression is made of that particular area, and we place crown or bridge on that dental implants. By this way we save the adjacent natural teeth. We don't have to go for any irreversible changes for the adjacent teeth. We can place artificial teeth directly on the dental implants which are inserted under the jawbone. But these dental treatments are selected according to the type of the patient, according to the intraoral condition of the patient, according to the different systemic diseases which are there for the individual patients. So basically you have to keep in mind that there are 3 basic dental treatment given to the edentulous patient, partial or completely edentulous patient. Removable prosthesis, fixed prosthesis. In fixed prosthesis, advanced dental treatment is dental implants. So there are examples like dentures, dental bridges and dental implants. These are the few treatment options available for the management of the patient. So as I told, dental implants, those are artificial tooth roots surgically attached to the jaw to secure or replacement tooth, bridge or denture. Dental implants can also be used with a denture for better stabilization according to the different indications and contraindication for particular patient. Dentures, you all know dentures are used by many family members in our family, in our area. Dentures are removable replacement for missing teeth and adjoining tissues. Partial dentures fill in the spaces created by the missing teeth. This is the example of the partial denture, and this is the example of the completely denture. Okay, so this is the example of the partial edentulous patient, and this is the example of the fully edentulous patient. Okay, so partial dentures fill in the spaces created by the missing teeth, keep remaining teeth from shifting, and are option if you have some natural teeth remaining. If you lost most or all of your teeth, complete or full dentures are recommended. Dental bridge, as I told, this is a fixed dental treatment option. A dental bridge is a false teeth that is fused between 2 porcelain crowns to fill in or bridge the space left by missing teeth. The 2 crowns holding the dental bridge in place cemented to your teeth on each side of the space. The bridge is secured into the place and is irremovable. That means patient cannot remove by its own. In conclusion, I would like to say that the quality of person's life determines greatly what happens at old age. So let's try to improve on our attitudes towards oral health so as to decrease the prevalence of edentulism. That means prevention, they say, is better than cure. So in conclusion, I would like to say that, to revise, the partially edentulous patients are where few teeth are missing. Completely edentulous patients are, that means complete set of teeth, that is maxillary and mandibular teeth, all the teeth are missing. According to that, different causes can be given in particular patient, and different treatment options can be given in particular patients. So we will complete with today's presentation. Thank you. Thank you.